Okay, this is the ascending aorta. This is the aortic arch. Then you have the descending aorta. Right here, below the veins right here, you have the brachiocephalic head of the aorta. This splits into the right common carotid artery, and then you have right subclavian right here. These three branches, the most internal one is the vertebral artery. Directly next to that is the thyrocervical artery. Then this third one, you can just ignore, you don't need to know that. Then from the right subclavian, it turns into the axillary artery, and that goes all the way down through here. And then right where this vein ends, it turns into the brachial artery, and that goes all the way down to here. You have the ulnar artery, radial artery, then you have the interosseous artery, and then down here you have the palmar aortic arch. And then if you go up here, right below this vein in this humerus, you can see it better over here. This right here is the anterior humeral circumflex artery. And then down here, the thing to remember on this thing is the arm isn't in anatomical position right here, the hand. So the radial and ulnar arteries actually switch here. So instead of radial being on this side, ulnar is here, radial is here. And then basically to remember on just for Flat Stanley, it's not too detailed. Just remember up here in the pulmonary system, the arteries are actually blue and the veins are actually the red ones. It's switched around, it's backwards. Okay.
Just on the Flat Stanley?
Yeah. And then you go into the abdominal area, you have the descending aorta still. It has the celiac artery, which splits into three branches. You have one branch going to the spleen, you have one branch going to the gastric artery, splenic artery, and hepatic artery. And then you have the superior mesenteric artery, and then you have inferior mesenteric artery, like right down here. And then you also have renal arteries here and here. And then this is a gonadal artery, this one little branch right there. And then these are common iliac, up until it reaches this branching point right here. Those are internal iliacs. These are external iliacs that go down here. And then you have the femoral artery, which goes down here. Femoral artery. This is lateral ascending, lateral descending circumflex of the femoral artery. Then down here you have the popliteal artery. There should be more branches, like right around here. It's better on the other Flat Stanley. And then if you go back down here, you have posterior tibial artery and anterior tibial artery. And over here you have medial circumflex of the femoral artery going through this side right here. Then here you have the femoral artery, and then this is the genicular artery. And then down in here, some people were talking about the perineal arteries. I don't think you need to know them, but they're superficial, deep, and common perineal arteries. I don't really know them. They're just in this general area right here. And then if you go down to the bottom of the foot, I'm not sure whether you have to know these or not, but you have the plantar aortic arch down here somewhere, and then basically plantar is the bottom one, and then the one above it would be, it's called dorsal pedis, something about that. So that's it for the arteries. For the veins, you start here with the superior vena cava. It goes up, it's called the brachiocephalic, goes right and left. You have the left subclavian, right subclavian. The right subclavian splits up here. This is a cephalic vein. It goes all the way down to here, and then I'll talk about how that splits later. Then from the right subclavian, that splits into the axillary vein. And then this right here, ignore that top one. This right here would be the brachial. It's not shown completely, but this is a brachial vein. Then this right here is the bacillus vein. That is all bacillus. And then down here you have antebrachial for this right here. And then antecubitus, antecubital for this vein over here. And then for the descending, the inferior vena cava right here, it does not have an inferior mesenteric, but it does have a superior mesenteric. And then pretty much all the same stuff correlates with the arteries and stuff for like iliac down here and stuff.
Dude, you forgot the mediosacral stuff for the arteries.
What mediosacral?
It's like below. You know when it's
This right here is like sacral. Medial sacral arteries. So. And then right here you have femoral vein going down this side. This going all the way down this side is the great saphenous vein. And that's pretty much the only special things for the veins. The other stuff is pretty much the same.
Thank you.